Hi, I am Dr. Sarah Collins. Before we go any further, let me ask you something important. Have you ever stood in a dark hallway in the middle of the night, half awake, half exhausted, slowly walking toward the bathroom again, and wondered when this became your normal? Have you ever laid back down afterward, staring at the ceiling, knowing your sleep is broken but feeling powerless to stop it? If you're over 40, over 50, and quietly dealing with urinary changes you never planned for, I want you to listen closely, because this matters more than you've been told. Here's the truth most people never explain clearly. These changes don't start loudly. They start subtly. A slightly weaker stream, a few extra seconds before flow begins, one more nighttime trip than you used to make. And almost without realizing it, your body adapts to inconvenience, discomfort, and disruption. You begin planning around bathrooms. You stop drinking fluids later in the day. You accept broken sleep as part of aging. But what if I told you that this story, the one you've been handed, is incomplete? In this video, I'm going to explain why so many men feel trapped by urinary symptoms, why it often has less to do with prostate size than you think, and how a simple habit, one that takes about 30 seconds, can noticeably improve flow, reduce urgency, and help you feel more in control again. This is not hype. This is not a miracle promise. This is about understanding how your body actually works and using that knowledge intelligently. Many men are told, directly or indirectly, that urinary problems are just the cost of getting older. That once the prostate changes, discomfort is inevitable and permanent. That belief alone creates frustration and resignation. But biology is rarely that simple. What you experience day to day is not determined solely by a scan, a number, or a measurement. Symptoms are shaped by mechanics, pressure, muscle behavior, bladder signaling, inflammation, hydration timing, and something almost no one talks about: how your nervous system behaves when you urinate. Two men can have nearly identical prostate measurements and completely different lives. One functions reasonably well. The other feels miserable. The difference is not luck. It's how the system is functioning as a whole. Let's talk honestly about what this feels like in real life. Nighttime comes, and your sleep is no longer continuous. You wake up once, maybe twice, sometimes more. You're not fully awake, but you're awake enough to feel irritated. Over time, that fragmented sleep leaves you tired before the day even begins. During the day, you notice hesitation before your stream starts. You wait, you push, you tense, and then comes that familiar feeling that you're done, but not really done. Minutes later, your bladder signals again. There's also a quieter part that many men never say out loud: the constant scanning for bathrooms. The unease during long drives, meetings, flights, or social events. The background tension that never fully turns off. That stress does not stay in your head. It lives in your body. When your nervous system is on edge, your pelvic floor muscles tend to tighten. Your breathing becomes shallow. Your abdomen braces without you realizing it. And when you try to urinate in that state, you're no longer allowing release. You're forcing function. That force increases pressure. Pressure irritates sensitive tissue. Irritation amplifies urgency. And the cycle reinforces itself. This is one of the most overlooked contributors to urinary discomfort in men over 50. You can have a moderately enlarged prostate, but a pelvic floor that is gripping like a clenched fist. That combination often feels far worse than the imaging suggests. Meanwhile, another man with a larger prostate but better muscle coordination and relaxation may function surprisingly well. The system is adaptable. It is trainable. But only if you stop fighting it and start working with it. Before I explain the habit that helps reset this cycle, I want to clarify something important. When people hear phrases like "improve prostate symptoms," they often expect immediate, dramatic change. Real bodies don't work that way. Prostate tissue changes slowly, but muscle tension can release quickly. Bladder signaling can calm within days. Residual urine can decrease faster than most men expect. And those changes alone can dramatically improve comfort, urgency, and confidence. What most men want isn't perfection. They want fewer nighttime trips, a smoother start to flow, less urgency, a feeling that their body is cooperating again instead of resisting them. That's where the habit you'll learn in this video comes in. It does not replace medical care. It does not ignore real anatomy. It works because it addresses mechanics that are almost always overlooked. Now, let's slow this down and explain what's really happening inside your body. Because once you understand this, the frustration starts to lose its grip. Most men believe urine flow is controlled mainly by the bladder pushing and the prostate getting out of the way. That's only part of the picture. The truth is, urination is a coordinated release, not a forceful act. And coordination depends heavily on your nervous system and pelvic muscles. Think of your bladder like a pump and your outlet like a valve. If the valve is tense, irritated, or partially closed, the pump has to work harder. That extra effort creates pressure, and pressure is exactly what worsens urgency, incomplete emptying, and that constant feeling of needing to go again. Many men unknowingly make this worse every single time they use the bathroom. Here's how. The moment you feel the urge, your body anticipates struggle. You walk toward the toilet already braced. Your jaw tightens. Your shoulders lift. Your abdomen firms up. Some men even hold their breath without realizing it. Then, once positioned, they push. That push sends a signal to the pelvic floor to contract, not relax. It's the opposite of what you want. This pattern doesn't come from weakness. It comes from years of trying to compensate. Over time, the pelvic floor learns tension as its default state. The bladder becomes more sensitive. Signals fire earlier. Nighttime awakenings increase. And men are told the prostate is solely to blame, even though muscle behavior is quietly amplifying everything. This is why symptom severity often doesn't match scan results. It's also why medications sometimes help only partially. If the mechanics are off, relief stays limited. Now, let's talk about what actually improves the situation. The goal is not to push urine out faster. The goal is to reduce resistance so urine flows more easily. That difference matters more than most men realize. The habit I'm sharing works because it does two critical things at once. First, it downshifts your nervous system so the pelvic floor stops gripping. Second, it gives your bladder a second, strain-free opportunity to empty more completely. Less leftover urine means less urgency later. Less urgency means fewer repeat trips. And fewer repeat trips mean calmer signaling overall. This process begins before the stream even starts. When you approach the toilet, pause for just a moment. Take a slow, gentle inhale through your nose, about 4 seconds. Nothing dramatic. Then exhale slowly through your mouth for 6 to 8 seconds, as if you're softly fogging a mirror. As you exhale, let your jaw loosen. Let your shoulders drop. Let your belly soften. That long exhale sends a powerful signal to your nervous system that it's safe to release. Not push, release. Imagine the base of your pelvis gently lowering, like an elevator descending one floor. No bearing down, no effort, just permission. Many men are surprised by what happens next. The stream often starts more smoothly. There's less hesitation, less strain. That's not coincidence. That's mechanics working in your favor. As you urinate, stay relaxed. Keep breathing. Don't rush the process. If you're standing, keep your knees soft and your weight balanced. If you're sitting, allow yourself to sit comfortably without tension. Sitting is not a sign of decline. For many men, it actually reduces pelvic floor activation and improves emptying. When the stream stops, resist the urge to leave immediately. This is where the second part of the habit matters. Stay where you are and count slowly to 10. During that pause, take one more long exhale. Again, 6 to 8 seconds. Repeat the same gentle downward release at the base of the pelvis. Then wait. Often, a second stream appears. Sometimes it's small. Sometimes it's surprisingly significant. That second release reduces residual urine, which is one of the biggest drivers of urgency, nighttime trips, and that frustrating feeling of not being finished. This entire routine takes about 30 seconds longer than usual, but its effects last much longer. Less pressure means less irritation. Less irritation means calmer bladder signaling. Calmer signaling means fewer interruptions to your sleep and day. It's important to understand what this habit is not. It is not forcing relaxation. It is not straining harder. It is not trying to empty every last drop aggressively. Aggression is what got the system stuck in the first place. This is retraining. Every time you use this approach, you teach your body the same lesson. We release. We don't fight. Most men notice subtle changes quickly. The stream starts more easily. The sense of urgency softens. The number of repeat trips decreases. Over weeks, those small improvements compound. Sleep becomes more continuous. Anxiety around bathrooms fades. Confidence quietly returns. In the next part, I'll explain what mistakes to avoid, what habits can either support or sabotage this process, and what warning signs should never be ignored. Stay with me, because knowing what not to do is just as important as knowing what helps. Now, let's talk about what can quietly undermine this progress if you're not aware of it. Because even the best habits work best when you avoid the most common traps. One of the biggest mistakes men make is turning relaxation into another form of effort. If you catch yourself thinking, "Am I doing this right?" or "I need to relax more," you may actually be reintroducing tension. This is not about perfection, it's about softness. If your breathing is slow and your body feels less guarded, you're doing it correctly. Another mistake is rushing. Many men treat urination like a task to get through as quickly as possible. Speed encourages force. Force increases pressure. Pressure worsens irritation. Slowing down by even half a minute changes the entire mechanical environment. That pause is not wasted time. It's therapeutic time. There's also a habit many men underestimate: ignoring bowel health. Constipation places constant pressure on the bladder and prostate region. Even mild backup can worsen urinary symptoms significantly. If bowel movements are infrequent or strained, urinary improvement will be limited. Hydration, fiber, gentle movement, and regular timing matter more than most men realize. Late evening fluid habits are another silent contributor. Drinking large amounts close to bedtime, especially caffeine or alcohol, increases nighttime signaling and bladder irritation. Shifting fluids earlier in the day can make a noticeable difference within a week. This is not about deprivation, it's about timing. Now let's talk about what supports this habit beyond the bathroom itself. Gentle daily movement helps circulation in the pelvic region. A short walk after your largest meal improves digestion and reduces pressure on the bladder. Warmth relaxes muscle tissue. A warm shower in the evening can ease pelvic tension before sleep. Even a few minutes of slow breathing outside the bathroom helps retrain your nervous system, so relaxation becomes easier when it matters most. What many men don't realize is that urinary symptoms are not just physical. They are deeply tied to stress patterns. Years of coping, worrying, and anticipating discomfort teach the body to stay guarded. When you interrupt that pattern consistently, the system begins to recalibrate. Men often ask how quickly they should expect results. While everyone is different, the pattern is remarkably consistent. Within the first few days to a week, many notice smoother initiation of flow. Over 2 to 4 weeks, repeat trips after urination decrease. Over a month or more, nighttime awakenings often reduce, sleep improves, and baseline urgency quiets. These are not dramatic overnight transformations, but they are meaningful, cumulative changes. I've seen men in their late 60s and 70s regain confidence they thought was gone for good. One stopped planning his life around bathroom access within weeks. Another began sleeping through most nights again after years of disruption. A third realized how much tension he had been carrying and described the relief as finally letting his body rest. Calm is often the missing ingredient. That said, it's important to know when to seek medical care promptly. If you experience blood in your urine, fever, burning pain, sudden inability to urinate, unexplained weight loss, or rapidly worsening symptoms, Those are not things to manage on your own. This information is educational and supportive, not a replacement for personalized medical care. Always consult a licensed healthcare professional when symptoms are concerning or changing quickly. For everyday management, though, consistency is what matters most. Treat this habit like brushing your teeth. It's basic hygiene for your nervous system and pelvic outlet. Every time you urinate, you reinforce the same message. We release. We don't force. That lesson adds up. You are not broken. Your body is not betraying you. It is responding to years of patterns that can be gently retrained. Aging does not mean surrendering comfort, dignity, or control. It means learning how to work with your body more intelligently. If this resonated with you, take a moment to reflect on which symptom bothers you the most right now. Nighttime trips, weak stream, urgency, incomplete emptying. That awareness alone is powerful. And if you found this helpful, stay connected. More guidance like this can help you move forward with confidence, not fear. Thank you for staying with me through this. Small changes done consistently can restore calm, comfort, and quality of life far more than most men are ever told.